Hi everyone, my name is Dr. Beth Kitchen and I'm an assistant professor at the University of Alabama at Birmingham's Nutrition Sciences Department. May is National Osteoporosis Month, and I am really excited about that because not only do I work in the Nutrition Sciences Department, I am also the patient educator in our osteoporosis clinic at the Kirkland Clinic at UAB. And so this is a really great time for me to get all this information out about osteoporosis and what you can do about it. In our clinic, we spend a lot of time educating patients on what osteoporosis is. And so over the next couple of weeks, I'm going to be talking a lot about this and also help you to decide if you're at risk and what you can do about it. So let's answer a first really important question, and that is, what is osteoporosis? And most people, when they've been diagnosed with osteoporosis, they tell me I have brittle bones or thinning bones or fragile bones. And that's actually a really good way of describing what is happening in your bones when you have osteoporosis. This is what it looks like. You can see here this bone on the left, especially compared to the bone on the right, looks pretty good. And that's a pretty normal, healthy bone. Now, some of my patients, they look at that and they say, yeah, it definitely looks better than the bone on the right, but it still has some holes in it. And interestingly, a lot of the bones in your body actually have this sort of honeycomb structure. And so that's actually a pretty healthy bone. Now you can see a big difference with the bone on the right. This is a bone with osteoporosis. And not only is the bone that's there thinning, you can also see these missing what we call cross bridges. That bone there used to be connected, and you can see it's not connected anymore. This one's getting close to not being connected anymore. So it's not only thinning, it's also missing these connections here. And that makes for really weak bones. Now, one of the things about osteoporosis that's really important to understand is that it's a silent disease. You don't feel the bones thinning. It's not like osteoarthritis, which is a joint disease, where you might feel pain, you might see swelling. It's not the way osteoporosis is. You don't feel it. You're going along in your day, you feel fine, you look fine, you're doing all the things you've always done because thinning bones don't hurt. The problem is they break a lot more easily. And that's the part of osteoporosis that can be very dangerous, very debilitating, and really have a negative impact on your life. Now, the good news is that osteoporosis is not inevitable. There's a lot you can do, not only to prevent osteoporosis, but if you have it, to treat it and prevent breaking bones. And that's the most important thing, fracture prevention, not breaking a bone. And that's what we really gear our osteoporosis treatment for. So in the next segment, what I'll be doing is helping you to decide, first of all, if you are at risk for osteoporosis and if you should get tested for it. And then we'll go from there and talk about all the things we can do to keep our bones healthy and lower those chances of breaking a bone.